Due to popular demand, the bunnies are back. I'm going to explain to you how the lung works using bunnies. Lungs have two main functions. One is to get rid of carbon dioxide through exhalation, and the second is to inhale oxygen. The oxygen I want you to consider as little bunnies. Each oxygen molecule is one bunny. Now, when you inhale, the air makes its way down to the airways all the way distally into what we call alveoli, which are sacs or pockets of air. You have about 300 to 500 million of alveoli distributed in your bilateral lobes. Right beside each of these alveoli, you have little capillaries. These are the smallest and the most abundant blood vessels in your body. They connect arteries to veins. Now, I want you to consider the junction where the alveoli and the capillaries meet as a bus station. And your buses are your hemoglobin, which is going to be in the capillaries and your red blood cells. Normal lungs, there are a lot of bunnies waiting for the bus at the bus station. Once the bus arrives, bunnies jump on, bus takes a ride to the rest of your circulatory system. In someone with asthma or COPD, you can think of it as like the roads that lead to the bus station are narrowed or blocked, meaning there's probably a lot of buses waiting at the bus station, but the bunnies can't make their way to the bus station to jump on. In pneumonia, the bus station is filled with fluid and pus, so the bunnies in the alveoli can't really jump across and make it to the bus station as effectively. And in patients with anemia, they do have a lot of bunnies hanging around. The bus station is completely fine, but they don't have enough buses for the bunnies to actually hop on and then complete the full circulation. And a way to think about the oxygen hemoglobin dissociation curve is think about how much the bus driver loves bunnies. If the bus driver loves the bunnies so much, he's not going to want to let them go. If he doesn't love them a lot, he's going to want to let them go really, really quickly. If your body is really hot, acidic, or has high CO2 levels, maybe from exercise, sepsis, or shock state, then this is called a right shift in your oxygen hemoglobin dissociation curve. And this is when your bus driver is more likely to let go of the bunnies really easily. He's like, I don't want the bunnies, get them off my bus as soon as possible. And this is helpful in a state like sepsis because there is increased metabolic consumption and demand, and you need that extra oxygen to actually support organ perfusion. And when you're cold, alkalotic, or have low CO2, the oxygen curve shifts to the left, which means the bus driver now does not ever want to let go of the bunnies. So now the bunnies are stuck on the bus and have a harder time getting off.